I am Dr. Ramesh Babu, cardiologist, Medwin Hospital. Today we have launched HAPPY, Health Awareness Promotion Project India. This is an initiative to prevent non-communicable diseases, also called NCDs, in the IT community in Hyderabad. As you know, the United Nations has passed a resolution in the last General Assembly on September 19th and 20th declaring NCDs as the new global emergency. It's only the second time in the history of United Nations a general body has been called for a health-related issue. The last one was 11 years ago when they have declared HIV as a global emergency. After the United Nations has declared HIV as a global emergency, there's a sea change in the attitude of the global aid agencies. A lot of money has flown into HIV/AIDS programs in Asia and Africa, and it has shown a tremendous impact. Now we expect that once this declaration has come, there will be a lot of change in people's attitudes. All these years, even countries like India used to focus on infectious diseases, maternity and perinatal problems. We used to think they are the number one priority. We still have a problem of infectious diseases and maternity and perinatal problems, but we have the problem of the NCDs also. It's absolutely mandatory we start working on both those conditions. All these years we used to think that let's first control the infectious diseases before we start working on the NCDs, but that will be too late. It will be a tsunami in the making. It's absolutely mandatory that India works on the NCDs. So this health awareness promotion project in India will take the message of what our NCDs are, how to prevent NCDs into the IT community, later other industries in Hyderabad, and later to the rest of the cities and to the rural areas. We want to even experiment with the use of how to use mobile technology to prevent NCDs. That will be the next phase of our project. As I said before, NCDs constitute 4 major diseases: cardiovascular, cancer, chronic lung problems and diabetes. Even though they look separate, various different groups of diseases, the risk factors are the same. That's the reason all of them been lumped together as the NCDs. High blood pressure, high blood cholesterol, smoking, lack of exercise, eating unhealthy diet, consuming too much of alcohol are responsible for the majority of the NCDs. Surprisingly, by just controlling 4 factors, by walking every day, eating healthy diet, by stopping tobacco in all forms, both smoking as well as chewing, and controlling alcohol, by controlling 4 risk factors, 80% of the NCDs can be prevented. 60% of the global deaths are because of non-communicable diseases. Unfortunately, 80% of them happen in countries like India, low and middle income countries, also called the LMICs.